Have you ever heard of a penile fracture? It sounds impossible. After all, there are no bones in the penis, but it's absolutely real. And if you think sex can't cause injuries, think again. Hi there, I'm Dr. Camilla, host of the Intimacy Lab for Ubi Health. As one of the AI faces of Ubi's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to various issues around sex, sexual health, relationships, and intimacy. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Let's talk about one of the lesser discussed but absolutely critical topics: sex-related injuries. While sex is often seen as pleasure-filled and playfully spontaneous, the body still has limits, and sometimes those limits get crossed. Let's start where a lot of jaws drop: penile fractures. Despite the name, it's not an actual bone that breaks. There's no bone in the penis. What's actually happening is a rupture of the tunica albuginea, the fibrous tissue that surrounds the corpora cavernosa, which are the spongy chambers that fill with blood during an erection. When too much force bends an erect penis sharply, especially during vigorous sex, it can cause a popping sound, immediate pain, and rapid loss of erection. It's a medical emergency that requires surgery to prevent long-term complications. Thankfully, it's rare, but it's a reminder that more intense doesn't always mean better or safer. Next up, muscle strains. Sex is a physical activity. Some might even say it's a full contact sport. Pulled hamstrings, lower back injuries, even neck spasms are relatively common, especially when folks are exploring new positions or pushing past their flexibility limits. One of my patients, let's call him Jordan, once asked if it was normal to pull a groin muscle mid-thrust. The answer? Not common, but certainly possible. Warming up your body with gentle movement beforehand, stretching regularly, and staying hydrated can go a long way in preventing muscle-related mishaps. Another quiet culprit? Micro-tears, particularly in the vaginal or anal tissues. These can happen when there isn't enough lubrication, when toys or penetration are too rough, or sometimes just due to the natural fragility of the tissue, especially during hormonal shifts like menopause. That doesn't make you fragile, it just means your body is asking for more care. Using the right type and amount of lubrication, building up to penetration slowly, and practicing ongoing consent with your partner can significantly reduce this risk. And speaking of lubrication, some lubes can trigger allergic responses. Symptoms can range from itching and swelling to full-blown hives. Always patch test new products, and avoid anything with strong fragrances or glycerin, especially if you're prone to yeast infections. If you're using condoms, make sure your lube is condom safe. And keep in mind that some folks have latex allergies too. Let's also talk about foreign objects. Whether it's sex toys or things not designed for penetration at all, if it's going inside the body, make sure it's body safe. There was a case recently shared by a colleague where someone used a non-medical object that didn't have a flared base, and it ended up in the ER. That's not a rare story. If you're exploring with toys, make sure they're made of non-porous, non-toxic materials and designed specifically for wherever you intend to use them. And here's a moment of honesty. Not all injuries are physical. Emotional or psychological harm can result from sex that feels rushed, disconnected, or not fully consensual. Trauma-aware communication before, during, and after sexual activity matters just as much as physical safety. Now for one more thing that often gets overlooked: heart health. Sex is cardio. If you're living with a heart condition, serious hypertension, or chronic fatigue, talk to your doctor before engaging in vigorous activity, because sex counts. One of the most common stories I hear, especially among older men, is landing in the ER with chest pain after sex. It's not about fear. It's about honoring your body and working with it, not against it. Here's the actionable part. Take a moment today to check in with your body. Are you feeling sore after sex? Noticing unusual discomfort or emotional aftershocks? Your body is always communicating with you. You don't have to ignore it. Worried about your own health? Start by checking in with the Ubi Symptom Checker at ubihealth.com. Its medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And if you found this helpful, like and follow for more doctor-approved info you can trust. From Ubi Health and the Intimacy Lab.